Watching another episode of What Do You Need to Know to Live in Costa Rica. Today we're talking about health care and health insurance in Costa Rica. That's right, we're talking about healthcare in Costa Rica. I'm Aaron Bailey, joined as always by my good friend and business partner, Patrick Jager. Hello, Patrick.
Hello, I am healthy today, so this topic is more one for information, just so we're all clear.
I've got a little bit of a tingle in my throat. Tickle in my throat, but I think I'm healthy. So yes, thankful for that. Patrick, before we get into this topic, let's remind everyone that if you find value in this content, we would really appreciate if you could give this video a thumbs up, smash that subscribe button, leave a comment, shoot us an email, hola@yourpuravida.com, with any questions or interest in talking to us about moving to Costa Rica. Okay, Patrick, let's talk about healthcare. How does it work here?
We do not have one person that reaches out to us, not one, that doesn't bring up healthcare, health insurance, or both, asking a question: how does it work? When will I need it? Do I need it? What have you? So this video is probably well overdue. Yes, Costa Rica has universal healthcare. First thing to know, no, it's not free. So we're going to walk through all of that. Let's talk kind of just generics of that. Our public system, known as the Caja, is an income-based contribution system. So the easiest way to liken this is it's very much like the Canadian system. You pay in through your taxes, and for that you have universal health care. The good news about that is that you have universal health care. The challenge with that, especially if you have a condition that needs a specific surgery, what have you, you might be on a wait list for a while. So to augment the public system, many people also have private health insurance that they can use, especially when they have something really important like an operation they need to have, and they do that through one of the private hospitals. Both of those are important to know that neither one of those, though, is an option for people when they first move to Costa Rica. And for that, we're going to go through some other options as well. Yes, you can have health insurance here. Yes, you're going to have to run through some hoops to get it. Yes, that's what we're here at Your Puerto Vida to help you figure out. So with that in mind, Aaron, why don't you start us off and kind of walk through the public system?
So the public system, La Caja, as it's known, is required if you become a temporary or permanent resident. You have to enroll in the system, and you have to contribute into that system based on however it is that you get residency here. So if you have a pension, Social Security from the U.S., for example, you'll pay a percentage of that pension, of that monthly amount, to La Caja for your care here in Costa Rica. The benefits, and that's something that we can help you navigate and think through, and we can connect you with the right immigration attorney that can also to enroll you in into the system. The beauty of the La Caja is that it is broad. There are clinics across the country. And it includes pre-existing conditions and low cost of care at the point of needing it. Oftentimes, a vast majority of times, it's free. The trade-offs for that are the wait times. You can only go to a Caja, a Social Security, a clinic, and you have less control over that schedule. So really, oftentimes you'll go to La Caja for certain things, but you might want to see a private doctor for other things. And that's all something that just becomes second nature once you get enrolled in the system and figure out how it works.
Yeah. So talking about the private doctors, when you're thinking about having private healthcare insurance here in this country, as I said, a lot of internationals and a lot of Ticos as well will have a private healthcare insurance plan as well. It allows you faster access if what you want is English-friendly specialists. Caja, you're not going to have people that speak English. or you might have a nurse or a doctor. And so a lot of times people, when they do go to Caja, are bringing someone with them that can become a translator, because that can be nerve wracking for some. The fact that now everyone's talking to you in a technical Spanish, and these are things that might be above your understanding level. On the private side, you're going to have more English friendly specialists at private hospitals. This is SEMA. This is Biblica. This is Metropolitano. The common insurance options are INTS, which is the state insurer, BMI, Pan American Life. There are definitely ones that are better than others for different reasons. Pan American is really good for group insurance. BMI or INTS are better maybe for private insurance. Working with a broker that can help you figure that out, and we help refer our clients to the right broker. You do not have to have residency to get private healthcare insurance. So for someone that is just moving into the country, private healthcare insurance might be an option they want to look at. Premiums can vary widely. And much like in a home country, there's a big difference between a HMO or a PPO style in terms of how much you pay up front versus how much you have as a deductible, what have you. So premiums can, anywhere from, I'd say, 150 to 300 a month, plus or minus, depending on your age, your benefits, pre-existing conditions. Some private companies will take certain existing conditions. Not all will. So again, you really have to think about it. The other thing is there are discount membership services. It's not insurance, but you can get discounted memberships that allow you to get reduced rates within networks that can work alongside a pay-as-you-go system. And a lot of people end up doing pay-as-you-go private here until they have their Caja or enroll in private. So lots of different options for you. Again, this is our job at Your Pura Vida, is to help you think through these things and connect you with the right people so that you're getting the very best policies that work for you, the very best information that works for you, so you can make the right decisions.
And I think then the other option that needs to be thrown into the mix is an international expat insurance that caters to people who are in the process of moving or who are moving around a lot. This is often a good option for when you first move to Costa Rica and haven't been able to establish insurance through a private insurance provider or have get access to the La Caja. These international expat health insurance are going to be more expensive, but they're going to be a good stopgap for those periods where you don't have insurance, like I said, here in Costa Rica. And again, pre-existing condition rules and the waiting periods are going to vary wildly. Oftentimes they'll come with medical evacuation. Sometimes they won't. So if you want to be evacuated back to United States, for example, sometimes they'll cover you while you're back in the U.S. Sometimes they won't. And they're at least worth looking at. But you're going to expect to pay higher premiums, $200 to $800 a month. Really depends on who you are. Look at, companies like Cigna or GeoBlue, for example. Those are good options to research.
It's interesting. We have a client that is spending multiple months scouting multiple countries, trying to figure out, is Costa Rica right for them? Is Panama? Is Portugal? So that type of plan, because you're going to be overseas in lots of different places, does work for them. You get what you pay for. You're not going to find a cheap plan there, because they're going to have to work across. You might get sick in Costa Rica and you get sick in Portugal. So they have to work across multiple platforms, and they have to be anticipating where you might go. It may or may not work. The other one to think about is who keeps their home insurance? What makes sense for keeping your insurance? If you are still working in the United States or Canada or what have you, and you're going to be splitting your time, in Canada, there's a certain amount you have to be in province to be able to still qualify for health insurance. If you are meeting that threshold, it might make sense for you to keep your Canadian health insurance. If you have a very good Medicare plan, or a VA benefit, or you are still working, you have a great PPO plan where you can kind of go back and forth and do certain types of healthcare when you're back in your home country. That might be something that's really important to think about keeping. There is no one size fits all. It's not like you move here and for most people, day one, you have to make that decision. It's about having the options that will allow you to really think through. The worst thing we would want you to do is abandon your health insurance plan that you have back in your home country. You move here and then 6 months later realize Costa Rica is not for us. And then you move back and you have to reapply. I don't know exactly how that would work. Depends on where you're from. So our job is to help you think through this stuff ahead of time.
We've got a client who's a retired school teacher from Michigan, where I'm from, and his pension gives him lifetime healthcare, and he looked into it, and he doesn't need private healthcare and insurance in Costa Rica because he just goes to the doctor and submits that invoice back to the United States, and they write him a check. They reimburse him. So
Amazing.
It really depends on who you are, what you've got access to, and that's something that we can help you think through and plan for.
So that really takes us to what do you need to know? How are you going to use health insurance once you move here? And there really is kind of a real world progression that you need to think about, from scouting, first relocation, once you get your visa, etc. Aaron, let's just walk through that.
Yeah, I think, if you're a new temporary resident, if you're here on a tourist visa while you're starting the process of becoming a resident, so maybe your first year in Costa Rica, you should look at potentially an international expat plan plus maybe a discount membership through MetaSmart, or SEMA has one, or Biblica has one, just so you get access to those services. And then once you're, enrolled in, once you've received that residency, that temporary residency, then you enroll in Caja right away. And then for pensionado long-term residents, let's say perhaps you're going to do Caja for your routine medicine, routine care. And then maybe you have a local private policy for accessing your preferred doctor, for example. If you find a private doctor that you really like, maybe you get a local policy, or maybe you pay out of pocket for that. It really depends on where you're located and what you're looking for. If, for example, you're a remote worker, you're not retired, you're still working, and you have a really strong PPO plan back in the US or wherever it is that you come from, then maybe you keep that, and maybe you add an expat digital nomad insurance for non-emergency care and maybe for medical evaluation back to the United States. I think the other group then would be veterans abroad. If you're a veteran, registering with the VA and understanding what you can access outside of the United States. And maybe you then pay out of pocket here locally, or maybe you get a supplemental private insurance plan, depending again on where you live in the country and what you're looking for, and your health needs. This all depends on really what your risk tolerance is and how healthy you are.
Yeah, we haven't talked at all about the fact that when we work with our clients, we also think about how frequently you need healthcare. If you are living and you need a weekly treatment, or, you need to have access because of a pre-existing condition to hospital care, just in case, you're not going to want to live in a remote beach or a remote mountain town. You're going to want to live in the greater metropolitan area, most most likely. So we help you think about not only what type of health coverage you might need, what type of health insurance you might need, but also what might make the best sense for you as to where to live. This is all part of what we try to do for even before you relocate in scouting, because in scouting, we don't want you to fall in love with living in, very, very remote wherever. And then you realize that you can't make that work because of what you need to have from a healthcare perspective. So it is a complex series of questions. This video does not do it justice. It's just to open the door. Our job is to then walk you through this and connect you to the right person that can make each of those pieces happen. Oftentimes, that's just one broker. For some people, that's more than one person. You're definitely going to have to do a difference between a health broker, a health insurance broker, and your lawyer who is going to help you with your immigration. That's our job, to help you figure through all that out. Very complex. We have a passion to do it because at the end of the day, our job is to get those who want to move to Costa Rica, help them figure out how. And this is a huge, huge part of that for most of us.
So the next step would be, if you want to talk to us, shoot us an email, hola@yourpuravida.com. Reach out. We'll send you a link to schedule a call with us so we can get to know you. Or go on our website, yourpuravida.com/links. Has a bunch of information on our website, but also has that scheduling link so that you can schedule a call with us. We can talk through your specific healthcare needs, your insurance needs, and then we can help you to start to plan for an eventual life here in Costa Rica. As you said, Patrick, there's no way we'd ever be able to do this topic justice in a 17-minute video, but we attempted to at least give you an overview. And so we thank you for sticking through a very deep topic. And I'm sure we will do more videos on this in the future. What else, Patrick?
I think that's it. Thank you all for watching. We are excited to bring you more like this. And until we do, Pura Vida.